You see hundreds of patients of fever daily in your OPD, and most of these fevers are viral fevers and they recover uneventfully. But occasionally, hidden among these hundreds of fevers could be a patient of meningitis, malaria, infective endocarditis, or even leukemia. So the challenge is to how to recognize these dangerous fevers before it's too late. So friends, in today's video, I'm going to tell you 5 red flags in fever that every doctor must be able to recognize early. If you could recognize these dangerous signs early, you could save many lives. So friends, today's video is very important. You see this video till the end, and if you have come for the first time on this channel, then do subscribe this channel for more such clinical tips. So friends, without wasting much time, let's start the video. So the first red flag is altered mental status. So this could be the typical case. A 25-year-old man presents with fever for 2 days. His temperature is 102 degree Fahrenheit. And during examination, you could notice either confusion, drowsiness, irritability, or reduced responsiveness. This is altered mental status. And the possible causes could be meningitis, encephalitis, cerebral malaria, or even septic encephalopathy. Now, what actions you should take in this case? So, you have to do certain investigations like CBC. You may have to send blood cultures. If you suspect malaria, you have to do malaria test. Then neuroimaging may be indicated in some cases. And if you suspect meningitis, encephalitis, you may also have to do lumbar puncture. And if the patient is serious, you will have to admit this patient in the ICU. So this was the first red flag, that is altered mental status. Now the second red flag is hypotension or shock. So a patient presents with fever and weakness. Patient's BP is 84/50. His pulse is 130 per minute and extremities are cold. So this is the typical presentation of patient in shock. So now the causes here could be severe bacterial sepsis, dengue shock syndrome, toxic shock syndrome, or gram-negative bacteria. Shock is more common in gram-negative bacterial infection. Now the actions here, you have to first secure the IV access because fluid resuscitation is very important here. Lactate measurement has to be done to see how the perfusion of the tissues is. Then early antibiotics are very important. In patients of shock, you will also have to use vasopressors, and appropriate case has to be referred to the ICU, or rather every patient of shock has to be referred to the ICU. So this was the second red flag, that is hypotension or shock. Now the third red flag is breathlessness or hypoxia. So here the patient comes with fever and cough. Patient's respiratory rate is 28 per minute and SpO2 is 88%. Now, what could be the causes of breathlessness or low SpO2 in fever? So, it could be due to pneumonia, pulmonary edema, ARDS, and severe sepsis. Now, what you will do here? Now, certain investigations are to be done, like X-ray chest. If indicated, you will also have to do CT chest. If you suspect H1N1 infection or COVID infection, then you will have to send throat swabs. Blood cultures are required here. Bronchoscopy also may have to be done in certain cases. Patient will require oxygen support and sometimes ventilator support. So this was the important third red flag, that is breathlessness. Now the fourth red flag could be petechiae, purpura, or bleeding. And here the young patient with fever, he could develop petechial rash, gum bleeding, epistaxis, or purpuric lesions. This type of fever can be seen in dengue, meningococcemia, in DIC, and even in certain hematological malignancies. Important investigation you have to do here is the coagulation profile, and you have to manage patient according to the investigation report. So this was the fourth sign, that is Petechiae purpura or bleeding. Now the fifth red flag is organ dysfunction. Any type of organ dysfunction is fever is a dangerous sign. A patient could develop reduced renal output, jaundice, elevated creatinine in the blood reports, or elevated liver enzymes. And this you could see in severe type of malaria, in leptospirosis, in sepsis, and in viral hepatitis. And this type of patient must be managed in the ICU. So now if the patient of fever comes to your OPD, this is a quick 30-second fever checklist. You should check the sensorium of the patient, then you should check the BP of the patient, whether patient is in shock, then you should check the SpO2 of the patient, then you should look for any signs of bleeding, and if there are any signs of organ dysfunction. So if you check these 5 things, then you could reliably exclude the dangerous causes of fever. Now some bonus red flags like extremes of age. If the patient is elderly or neonate, then it is a red flag. If the patient is immunocompromised, for example, patients who are on steroids or on immunosuppressive therapy, these patients are very vulnerable to dangerous infection. If the fever is prolonged for 2 to 3 weeks, then this is also a dangerous sign. Or if there is a history of travel to certain endemic regions, then it is also an important red sign. So friends, most of the fevers are benign. Our work is not only to treat the fever, but also to recognize the dangerous causes of fever early so that the patient can be referred timely to the higher center. And this video will help you in that. So friends, I hope that today's video was helpful to you. If you find today's video useful, give it a like, share with your friends, and if you have come for the first time on this channel, then do subscribe this channel for more such clinical videos. See you in the next video. Till then, thank you.